Okay, this is going to be my IV insertion video. I have gathered my supplies, provided for privacy. I've introduced myself to the patient, explained the procedure. I have positioned the client accordingly. I am now going to don my gloves and then place the tourniquet on the patient's arm so that I can find the correct vein. Then I'm just going to palpate. Once I find the area, I'm going to cleanse the site. And then I'm going to let it dry. Next, we are going to hold the catheter bevel up, anchor the vein, and insert at a 45-degree angle. Okay, once it's anchored in a little bit, you're watching for backflow. Once you see the backflow, you're gonna push it in a little bit more and anchor it here at the top, and then place your tubing here. Next, we're going to go ahead and cover this insertion site with a bandage. It is gonna have a label with date and time on there. And then we're gonna bring the tubing up to the patient's arm over here on the side. And also hold that in place with another piece of tape. Okay, now for initiating fluids, I am going to verify the IV solution order on the MAR and with the medical record. I'm going to go over the patient's chart for any allergies and also inspect the medication solution for any issues. I'm going to identify the patient. I'm going to perform hand hygiene and don my gloves. We are going to assemble the equipment and make sure it is nearby within reach. I'm going to provide patient privacy, and once again, I am going to verify the solution with the MAR. Maintaining that sterile field, I'm going to close the roller clamp on the IV, and I'm going to remove the cap on the entry site, making sure not to contaminate the exposed site. I'm going to remove the cap, and then I'm going to insert it onto the entry side of the IV container. And then I'm going to hang the IV container on the pole, squeeze the drip chamber, and fill at least halfway. Once that's done, we're going to open the IV tubing clamp and allow the fluid to move through the tubing. Now for maintaining and managing the IV site, we're going to evaluate it every 8 hours and make sure there's no complications. Always identify the patient using 2 different forms. You can palpate the site through the dressing, so make sure it's not inflamed or red or anything. Then you're going to change the tubing or the equipment every 72 hours. Now for discontinuing the IV, I'm going to have gathered my equipment, perform hand hygiene, don my gloves, identify the patient, and I'm going to turn off my infusion. Next, I'm going to go ahead and loosen the dressing. So let's take that off. And you can use alcohol swabs if it's way too sticky and you need to loosen it up. Then you're gonna anchor the site here. Okay, so I have my gauze here. I'm going to put it over the site, and then I'm going to take out the catheter and I'm going to apply pressure. Go ahead and tape this in place. And we can have the patient raise his arm to avoid clotting. And then we will observe the site for any swelling, redness. We're gonna dispose of our equipment and gloves, perform hand hygiene, and then we will recheck the site in 15 minutes.